some sounds. Again, under here. And if you'll lift your arms again, I'm just going to compare the lateral aspects as well. Once again, listening for dullness, hyperresonance, or fluid buildup. Okay, so now if I can just have you kind of turn this way, I'm going to go to the back. I'm just going to start by inspecting the back, making sure that she's breathing evenly, to make sure that the skin itself looks good. There's no rashes or lesions, no sores. Okay. Now I'm just going to listen to your lungs again from the back. So if you'll take a nice deep breath in and out. And I'm comparing both sides evenly. Again, listening for crackles, wheezes, rhonchi. You should hear nice, clear breath sounds throughout all of the lung fields. Work my way down all the way to the bases. And yours sound very clear as expected. Okay, very good. Oops. Okay. I'm also now going to percuss the back just as I did the front. Again, listening for areas of hyperresonance, dullness, once again fluid buildup. So I'm going to start right here. Again, I'm going to compare both sides evenly to one another. Okay, and while I'm here, I'm also going to percuss the costiovertebral angles, which is down here a little lower. And that's right here on both sides. No pain, right? Nope. Okay. I'll also measure the diaphragm and how well it expands. So if you'll take in a nice deep breath and blow it out. Nice deep breath. And I'm just marking the area where I hear the difference. And you can breathe normal now. Okay, take a nice deep breath. And hold it. And breathe normal. I'll just measure the difference of the angle where I hear the sound, and it should be 3 to 5 centimeters, which is normal, and that's good. Okay, and I'll also just measure how well the ribs and the thoracic cage expand. So if you'll kind of just put your arms across your chest and lean forward a little bit and take a nice deep breath. I'm just making sure that my thumbs move evenly and that one side's not pulling more than the other, which both sides are symmetrical and even. Okay. All right, so now if you'll lay back, I'm going to do an abdominal assessment. I'm just going to have you lift up your shirt just a bit. And again, I'm just going to inspect the skin. Just going to check the contour. There's no areas of visible herniation, no protrusion anywhere. The skin looks healthy. There's no rashes, no scars. The umbilicus is midline and inverted. I'm going to begin by listening to your bowel sounds. I'm going to listen to all 4 bowel sounds for up to 2 minutes if I don't hear anything. I'm going to listen to the right lower quadrant. I'm listening for gurgles, any areas of hyperresonance, hyperactive, hypoactive bowel sounds, listening to the right upper quadrant. I'm going to move over to the left upper quadrant and the left lower quadrant. Okay, all of her bowel sounds are normal. Okay, turning to the bell of my stethoscope now, and I'm actually listening midline for the aorta. I'm listening for any bruit. I'm listening to rate and rhythm. I'm going to go bilaterally to the right renal artery and then to the left renal artery. Again, listening for bruit. I'm going to go down to the iliac artery. I'm going to auscultate and then palpate that. Then to the left iliac artery. palpate that. I'll go to the left femoral artery and palpate, and the right femoral artery and palpate. I'll also feel for the aorta. I'm going to just put my fingers midline a couple centimeters apart. I'm feeling for the palpations and measuring the width with my fingers. Okay. Now I'm going to percuss and just feel the liver borders themselves. So just relax, breathe normal. I'm just listening for where the sound changes. I'm going to mark where the edge is, where the sound changes. And mark that edge, and that's the border of the liver, which is in defined limits. I'll then percuss the spleen, listening for sounds of dullness, hyperresonance. So if you'll roll to your side this way, actually, that gives you a little better angle of the spleen itself. And that sounds good as well. You don't want to be able to feel the spleen because that means that it would be enlarged. So you can go ahead and lay on your back. I'm just going to do a general percussion over the rest of the abdomen. Once again, listening for that dullness, hyperresonance. Once again, listening for fluid buildup or any areas that there could be masses or anything underneath the skin. Okay. Now I'm going to start with just a light palpation. I'm just going to kind of feel all four quadrants. I'm looking for nodules, masses, any lumps, and let me know if you have any pain. I'm going to palpate here for the liver. I'm feeling for the edges of the liver to make sure that it's not enlarged. Okay? And now I'm going to palpate for the spleen. I'm going to put my hand underneath her and kind of push forward and palpate for her spleen, and I cannot feel it, so that's good. I'm going to do a little deeper palpation to feel for the organs such as your kidneys, a little deeper palpation. No pain, correct? No pain. Any tenderness? Nope. And again, everything's within normal limits. So we're done with the abdominal assessment. There we go. Okay, so now we'll do the musculoskeletal and the skin. So you can actually sit back up. So just hold your arms out straight for me. I'm going to inspect the skin itself. I'm looking for lesions, any nodules, any rashes. Looking at her fingernails. Checking capillary refill. Making sure that there's no clubbing. Making sure that her cap refill is less than 3 seconds, which yours is very brisk. It looks good on both hands. Okay. I'm also going to palpate the pulses. So I'm actually going to start at the carotid. I'm going to palpate here. And I'm feeling for rate, rhythm, intensity. Okay. And I'm going to work my way down to the brachial pulse. Now to the radial pulse. The other side. Carotid. We'll go to the brachial pulse again. And the left radial pulse. Everything's even with good rate and rhythm. Okay, while I'm here, I'm going to go ahead and just do the reflexes. So if you'll just kind of rest your arm out, I'm going to just strike this little hammer, just kind of see how your arm reacts. And that's good. You want to see the hand kind of jump out a little bit. That's a normal reflex. So now I'm going to do the radial reflex. Same thing on this side. Watching again for the hand to jump, and at the wrist, that looks normal. Okay. Now I'm going to do a little bit of range of motion, so if you'll put your arms out for me, just hold them steady. Okay, I'm going to push down, and resist my push, and up. Okay, grab my hands, test your strength here. Arms out to the side, and push down again, push up. Very good. You can relax your arms. Okay, so now I'm going to go down to the lower extremities. Again, I'm looking at the skin, I'm making sure that there's good color, I'm looking at hair distribution, there's no areas of edema, I'm looking along the edges of the tibia for any pitting edema. I'm also looking again at the toes, testing the capillary refill, making sure that that's good in under 3 seconds. I'm going to feel behind the knee for the popliteal pulse on each side. Okay. And if you'll just bring your foot up, I'm going to feel for that tibial pulse and the pedal pulse on each side. And both of those are normal. I'll also look at your reflexes on your ankle. So if you'll hold your foot out for me, I'm going to strike the Achilles tendon here. And you want to see the foot kind of contract, so that's within normal limits. So I'll switch over here. One more time. That's good. Okay. Now I'll also do your knees bilaterally, so just kind of relax your legs. And that's good. You want to see the foot kick a little bit. Okay. Now if you'll just stand up for me. Face sideways. I'm going to look at the spine itself. So just kind of lean forward. I'm making sure that the spine is even. There's no curvature, no areas where it's pulling to either side. Okay. And while you're standing, I'm going to assess your mobility. If you'll just touch your toes, bend over and touch your toes for me. Okay. You have normal range of motion. Also, if you'll do deep knee bends, so I can assess. Good job. Joints look good. Everything moves fluidly. There doesn't seem to be any cracks or soreness. Also, we'll test for if you'll open and close your mouth. I'm testing this mandibular joint. There's no popping. No, that would indicate TMJ. There's no signs of that. Okay. Also, we're going to do a couple of neurological tests. So I'll actually have you sit right back here on the stretcher. Okay. First of all, if you'll hold your foot out, I'm going to do something that's called a Babinski Test. I'm just going to run the edge of this along the outside of her foot and across the top. We'll do each foot. Which that's normal. We were looking for where her toes would flare out.
Do a cranial nerve check, okay? So there's lots of different cranial nerves, and we just sort of do a few tests to cover those. So the first one is the olfactory nerve, which is smell. So I'm just going to get you to smell this and just see that you can actually smell something. Yeah? Okay, so that's smell is fine. Okay, next optic nerve. So that's visual acuity. So I'll get you to cover one eye with your hand and read the bottom row.
P, D, T, N, U, H, Z.
Okay, and then cover the other eye and read that row backwards.
Z, H, U, N, T, D, P.
Perfect. Now I'm just going to check your peripheral vision. So just look straight ahead, and I'm going to move a finger around, and I want you to tell me when you can't see it anymore, okay?
No, can't see it.
Mm-hmm.
No, can't see it.
Perfect, that's even on both sides. Okay, so that third cranial nerve is the ocular motor, so I'm just going to check your pupils. So look at my nose. Perfect. And do some blinking for me. Yeah, that's good, they're even. And now the trochlea and abducens, and that's for movement of your eyes. So I want you to keep your head still and follow the pen with your eyes only, okay? Down. Perfect. Okay. Now, facial sensations is the trigeminal nerve. I'm just going to, I'll get you to close your eyes and you tell me when you can feel me touching you with this tissue.
Yep. Yep. Yeah.
Mm-hmm. clench your teeth for me and stop me from opening your mouth. That's good. Okay. And you haven't had any problem chewing?
Oh, no.
No? Okay. So now the facial nerves. So some facial expressions we want to look at. So I want you to raise your eyebrows and look up. That's it. And puff your cheeks out and stop me from pushing in. Puff nice and strong. Good. And shut your eyes tightly and stop me from opening. That's it. Okay. And then the vestibulocochlear is hearing and balance. So I'm just going to get you to listen to me. So you're hearing me okay at the moment?
Yeah.
Okay, so I'm going to whisper and get you to repeat what I whisper, okay?
1, 2, 3, 4, 5.
Perfect. Okay. Now, you haven't had any problem with swallowing, you said earlier.
No.
So this is 9 and 10 nerves. And I'm just going to have a look in your mouth just to check that. So open up your mouth, poke your tongue out and say ah. Okay, and I'm just checking that your uvula is in the right place. And poke your tongue out for me. That's it. And move it side to side. That's it. And then just sit it in your mouth, open your mouth. And I'm just going to have a little look at your tongue. I'm just checking for spasming of those little muscles that are inside your tongue. Okay. And that was the hypoglossal cranial nerve, which is nerve number 12. So the accessory nerves is with your shoulders. So I want you to shrug your shoulders up and stop me from pushing down. Perfect. Okay. And move your head to the side. That's it. And to the other side. Okay, so that's all good. So that's the cranial nerves done. The next thing I'm going to assess is the strength and sensation in your arms and legs, okay? So I want you to squeeze my fingers. That's it. Pull me towards you. Push me away. That's it. And then just hold your arms out like that. That's it. And just keep them out. Close your eyes. And I'm just looking for a drift. There's no drift. Stop me from pushing down. Good work. Okay. And you've got no problem with me touching, as in you can feel me touching, same on both sides. Okay. So I want you to push on my hands with your feet. That's it. And then toes to your nose. That's it. And you can feel me touching your legs. Yeah. Okay. So what I want to do now is I want you to close your eyes and then tell me where I'm touching. Okay? Okay, so.
Right shoulder. Left arm. Left leg. Right leg. Right leg. Left foot. Right foot.
Okay. Perfect. So the next thing I'm going to test is your coordination, which is your cerebellar function. So I want you to touch my finger with your finger and now touch your nose and then keep going back and forth as fast as you can. Good work. Okay. Now I want you to put your hand on the other hand and then turn it over and go fast. Yep. Okay, perfect. Okay, now the next thing I want to check is what we call meningeal signs, and that's indicating whether or not there's any inflammation in the meninges of your brain. Okay, so I'll get you to lie down because one of the signs of that is neck stiffness. I know you said you didn't have any neck pain or anything before, but I'm just going to do a little test to check. Okay, so what I'm going to do is lift your head up and put your chin on your chest. Okay, so is there any pain there, Tara?
Oh no.
No? Okay. Now the next one is Koenig's sign, which I'm going to lift up this leg, and then what I'm going to do is I'm going to straighten this leg at the knee, and I'm just tell me if there's any really bad pain in the back of your leg and your hamstring there. No?
No.
This one. Okay, and straighten it. No, nothing?
No.
Okay, so you can sit back up again. So now I'm just wanting to assess your speech and comprehension. So can you name this object for me?
It's a pen.
That's a pen. Okay, now I'm going to give you some instructions. I want you to perform a task for me. So I'd like you to pick up that piece of paper, fold it in half, and put it inside that book. Perfect, thank you. Now I'll get you to just read 2 lines from one of those pages.
The third heart sound is a low-pitched mid-diastolic sound, but it's best.
That's good. That's enough. Thank you. Thank you. Okay, and can you repeat after me, yellow lorry?
The yellow lorry.
And what I'm doing there is just checking your tongue strength and whatnot. And baby hippopotamus is checks your lips.
Baby hippopotamus.
Baby hippopotamus. I'm just going to close this door just because that sound is coming in. Okay, so now that's well done. Now, I'll get you to write on a piece of paper for me. If you could write on a piece of paper, on that piece of paper, the sun always shines in Brisbane. Lovely, thank you. Yep. Okay. And now I just want to assess your stance and gait, okay? So I'll get you to stand up, and what I'm looking for is when you're walking around, just to make sure that you don't, you're not wobbly on your feet and that you're walking with an even gait. That's fine. Yeah. And now I just want you to stand there with your feet close together. That's it. And just close your eyes for a minute. This is checking whether you're balanced and not going to fall over. And that looks good. Okay, so sit down, Tyler. So, Tyler, have you taken...
I'm going to check your right side for your venous jugular pressure. I don't see any venous jugular distension. Next, I'm going to have you turn your head to the right. I'm going to use tangential lighting here, and I'm going to check for your point of maximum impulse. All right, it is noted in the lower 1/3 of your neck. I'm going to have you look this way, and I'm going to do the opposite here. Is noted on that side in the lower 1/3 as well. Next, I'm going to get measurements here. I'm going to measure your jugular venous pressure. So that's going to involve me putting this ruler on your sternum, excuse me, not sternum, clavicle, and then I'm going to match it up with the PMI here, and we're at 1.5 centimeters, which is below the 3 centimeters that would indicate some sort of health problem. So now I'm going to palpate your carotids. Sorry, 2 fingers on this side. All right. It's brisk. It's just this tapping sensation. I would say it's 2+. Also noted the same on that side as well. Next, we're going to find your point of maximal impulse at your apex. So I'm going to feel, we have first clavicular notch, second, third, fourth, fifth. So in between the 4th and the 5th, we're going to go to the mid-clavicular point here. And the PMI is felt right here with 1 finger. Next, I'm going to go back to the 3rd. We're going to feel this, which is Erb's point. You can feel the pulse there. 4th, which is the tricuspid. And then 5th, which is the mitral. Next we're going to go up to the second, which is the pulmonic. Palpable pulse is there, and then we're going to go to the right sternal border on the second intercostal space, and that's the aortic. And that is palpable as well. We don't have to do percussion because I was able to feel the PMI. Next, I'm going to take a listen to your carotids for bruits. Alright, no bruits were noted. Pulses sound equal and regular on both sides. Next we're going to use the diaphragm, and I'm going to second intercostal space on the right hand side, which is the aortic. Second intercostal space on the left side is the pulmonic. Third intercostal space left side is the Erb's point. Fourth is the tricuspid. Fifth is the mitral. And between the fourth and the fifth, midclavicular line is the apex, or the PMI. S1 and S2 were heard throughout. No abnormal heart sounds or murmurs were noted. So I would switch from the diaphragm to the bell. My stethoscope does both functions, you just have to press it harder for the bell function. So we're gonna go back to the apex, which is the fourth and fifth intercostal space, midclavicular line. All right, and then we're gonna move to the left side sternal border, fifth intercostal space, and fourth intercostal space. All right, no extra heart sounds were heard there. No murmurs. So what I'm going to have you do is I'm going to have you turn to the left in the left decubitus position. Dicey, I'm going to need you to move just a little bit there. All right. I'm listening to the apex. Once again, seeing if I can hear S3 or S4 or any sort of murmur of mitral stenosis. And none are heard. So what I'm going to have you do is sit up and lean slightly forward. And then, watch your arm here. I'm going to listen along the third, fourth, and fifth intercostal space as well as the apex on your exhalation. So breathe in and then breathe out. All right. Once again. Sorry, Dave. And then on the apex. All right. No extra heart tones were heard.